Good morning, good afternoon, and good evening from wherever you are. Thank you for joining us today on our fourth week of this year's HIV Prevention and Education Virtual Summit. My name is Kyle Shabasta. I am the Public Programs Manager here at the Community Health Training Alliance, an education and training program of Philadelphia Fight Community Health Centers. We've been learning so much this whole month about the issues that impact people living with HIV, and today is going to be no different. But before I introduce today's webinar, I just want to go over a few brief house rules. The chat is currently disabled. If you have any questions, please just place them in the Q&A box below. We're going to be facilitating all questions and answers at the end of today's presentation. Today's presentation is being recorded, so you can view this and all of our other presentations from this year's summit on our YouTube channel. Once this webinar has concluded, there will be a pop-up screen. And in that pop-up screen, you'll be prompted to just take a brief survey. If you'll just fill it out, let us know how we're doing. It informs how we go forward with future programming. That would be tremendous. So thank you. So with us today, we have Bevin Gwiazdowski and Dr. Marne Castillo, both from the Children's Hospital of Philadelphia. Today, they're going to be presenting on factors related to STI and HIV prevalence among house and ball youth in 2 US cities. So thank you so much for being with us today. And with that, the floor is yours.
Thank you. So I'm going to share my screen so that I can get the PowerPoint up. And hopefully, everything will go as planned. Okay, there we go. So as Kyle said, I am Bevin, and Marne is obviously here as well, and I am a study coordinator with the Adolescent Initiative, and one of the studies that I helped coordinate was Posse Project, and so we're going to talk a little bit today about some of the interesting things or things that we thought were interesting that we found. So just quickly, what we'll do is we'll provide an overview of the house and ball community and Kiki community. We'll talk a little bit about Posse and the theoretical frameworks that we used. We'll talk about the results of the study, and then we'll sort of look at the impact of local context and talk a little bit about health equity. So I don't know, Marne, if you wanted to do a little bit more of an introduction of yourself before we jump in.
Sure, thanks, Bevin. Thanks, everyone, and thank you to Philadelphia Fight for including us again in AIDS Education Month. This is something that is really important. We look forward to every year being able to support and participate and share some of the work that we're doing. And we're looking forward to hearing your comments and questions at the end. My name is Dr. Marne Castillo. I am the principal investigator on Posse for our site, Children's Hospital of Philadelphia, where I am also the clinical and research director for the Adolescent Initiative, our program that takes care of HIV positive youth, but also does prevention research and prevention and research in that area as well. So I will turn it back over to you, Bevin. Thanks.
So just to get started, so we're kind of all on the same page about what we're talking about when we're talking about the house and ball community, which we'll probably refer to as HBC through most of this as shorthand. So it's a subculture of the LGBT community, and it consists of primarily Black and Latinx, gay, bisexual, and transgender folks. And there are two sort of primary features within the culture. So there's these family-like structures called houses, which sometimes are actual in actual physical houses, but most times not. And then there are these performance-based competitions between houses called balls. And the balls are basically places where folks get to show off all of their talents in a variety of ways. And essentially, one of the reasons that this community sort of fits very well into what Posse Project is because of the structure of the community. But in general, the hierarchical status structure and the family-like structure of the community allows for a lot of blending of ages, which sort of encourages multi-generational mentorship, communication, and socialization within the community. So you'll see a lot of folks, young folks interacting with older folks and calling them mom, dad. They all have different like house names, and the hierarchy works that way as well. So the Kiki is a subculture of the larger house and ball community. So a lot of times the overarching community is called mainstream. And then the Kiki culture started because younger folks within the scene were sort of looking to have a space where they could engage with each other in sort of a slightly less pressured environment. But we're still able to sort of like practice and do all of the things that they were doing in the mainstream, just sort of in a less pressure. So it's younger folks. And as this sort of started to form, they started to develop their own separate system of houses and balls, and it definitely mirrors the structure of the larger mainstream scene. And the thing that also happens within the Kiki scene is that it provides a place for younger folks to sort of gain leadership experience, and while they're working on perfecting their talent, and they all sort of also mentor each other. And it helps to sort of just build safe space and community for their peers. You'll notice that on this slide, it says Kiki or family. That's because in Chicago, which is where this study also took place, the Kiki scene is called the family scene. So over the last several decades, there have been lots of examples of, the house and ball community being in pop culture or sort of popping up a little bit here and there. And the first sort of big thing that folks point to is the documentary Paris is Burning. And that was released in 1990. And Crystal LaBeija was another big name in the scene, Willie Ninja and Hector Extravaganza. And then most recently, I think folks are very familiar with Legendary and Pose. Pose just wrapped up their final season. Legendary is a competition-based show. My House was a documentary that followed folks around both in Philly and in New York, just sort of taking a look at what was happening for them in the scene. Kiki was a documentary that focused on the Kiki scene in New York. And then Vogue Evolution was a dance crew that appeared on a show I think it was like aired on MTV, if I remember correctly, and it was called America's Best Dance Crew. And Vogue Evolution was a group of folks who were Voguers, and actually one of those Voguers is now one of the judges on Legendary. So I hand it over to you, Marne.
Great. Thanks, Bevin. So hopefully you have just a little bit of an idea, if you didn't know, about House and Ball and Kiki communities, family communities. And just as a disclaimer, that was a very brief overview. We could do a whole session just on talking about those communities and just kind of what they brought and their history. Around that. So that was just really just very, very brief, just to give you kind of a sense of what the structure is as we talk about the project, because we tried to build off of some of the elements of the community in order to develop Posse. So Posse was a 5-year project. It was a community level health promotion intervention. We worked very closely with some researchers and interventionists in Chicago who we had known for a very long period of time, and they to come up with this project that was looking at adapting the CDC effective behavioral intervention popular opinion leader, which had been adapted for different communities. Some of you may remember it or know it as D-UP. But we wanted to look at it since it was a community level intervention. It really leveraged leaders in a community, and we thought that it would fit really well with the House and Ball community. So we wanted to do that adaptation to see if we could have an impact on HIV acquisition. And so since it's been a way to engage communities also and to mobilize communities, and we had, at least in Philadelphia and somewhat in Chicago, had been trying to make inroads within those different communities with other research projects and other interventions. So considering that at the time when we started, and based on what Bevin just showed you, when I used to do this talk, or we used to do talks about working with the House and Ball community and with members of the community 10 years ago, we would say that it was kind of a hidden group or more of an underground group. Well, I don't think that's the case anymore. I think that it's very much come into mainstream culture, as Bevin just described, all the different places that you can see and learn or hear about what's going on with the house and ball community. However, for many years, because there was this hidden nature, because some of the many of the members had joined the house and ball community because they were alienated from their own communities due to stigma and bias, they also were suffering from disproportionately from other kinds of health disparities, especially HIV acquisition. So with that in mind, thinking about what we knew about the house and ball community, what we knew as far as the how they were disproportionately impacted around HIV and STIs, we started building this intervention that eventually was called POSSE. And POSSE, when originally, as I mentioned, was based on popular opinion leader. And so for the next few slides, I want to talk to you a little bit about the theoretical frameworks. So the POL is based on the social diffusion theory, which according to the CDC is the premise that behavior change in a population can be initiated and then will then diffuse to others. So if you can identify the right people within the community who can then take on or understand and then impart what would that be either the behavior change or the ideas around the behavior change or the norms, kind of you can plant those seeds and work with those folks to be able to then spread that information and to influence other people within the community, that's one of the methods that you can have kind of wider spread behavior change, or at least within a community, so that these folks are going to endorse it and adopt it. So that was the basic premise when they created popular opinion leader many years ago. And I think a lot of that holds true for social diffusion theory. We also added a couple of other pieces or a couple of other theoretical frameworks that we wanted to utilize, and also just to kind of keep us, to keep things in line. And we thought that really fit with working with the community. One of these is called the asset-based community development. And I'm not sure exactly when we brought this in, but what we realized that what we were trying to do when we were working with folks in Philly and in Chicago was that this is a model that really made sense for us to keep in mind and to kind of work from, because building community capacity is at the heart of this theory. It's looking at the community members as content experts. They weren't just participants or just clients. Looks at micro assets to the micro environment. So everybody brings something to the table, and everybody's voice should be heard. And it builds on the assets that are already found in the community to mobilize folks, not the deficits, not needs or deficit focused. Oftentimes, we are looking at interventions because a community or individuals need something. They don't have something. They don't have the capacity to do something. So we have to help them with that. But in this case, if we can think about instead, what is it that the community already has that can be leveraged or can be built upon or can be reframed instead, in order to be able to move forward the community development. So I think this model for us has really been effective. And then of course there's the community participation research models. I'll just talk about a couple of them today, CBPR and the UCCP model. So these are CBPR. CBPR, for those of you in the public health world or do community work, is kind of like the ideal, right? So if you really are doing true CBPR, you like start from scratch. You don't, as far as if you're doing research, you're coming and you're really going to be able to just sit down with the community and work through and completely take from them what it is that what are the questions, what are the research questions, what are the hypotheses, how it's going to be done, and really do a from scratch model, which is ideal in many ways, sometimes can be done along the way, but oftentimes when we're doing research, we have to have identified some view or some question that we're trying to answer in order to be able to just basically to create a project, get funding, do all those kinds of things. But there are many ways that we can integrate CBPR methods into what we're doing. And I think what we wanted to make sure is that we recognize the community as a unit of identity. And we also have the community help us to identify what the community is. We build on the strengths and resources within the community. We try to involve people in the process as much as possible, and make sure that the transfer of information between the researchers and the community members is always reciprocal. So it's not just in one direction, and that there's also making sure that the outcomes that we are trying to achieve from a research perspective don't overshadow mutual benefit for all the people involved. And to continue a little bit more on CBPR is that, with community level change, community level research, you're looking at community level change. It's very different than doing individual level type of work, because we're really trying to look at broad scale social changes. And these take time. So these can be longer projects. They will definitely take a lot of resources, a lot of human time, people time. And looking at systems, also looking at different partners as the information comes through, looking at how that information is disseminated in order to share it and have all people involved to do that. And then also thinking about the community, not only as a geographic community, but also as a community of identity. So, for example, in this project in Posse, we were working with the house and ball community, but there's a community in Philadelphia, but also a community in Chicago. And even though we developed the intervention for thinking about house and ball, not necessarily thinking about the house and ball community in Philadelphia and in Chicago. So as we progressed, what we found, as Bevin and I kept talking, and we kept looking at all the different data pieces, and what we want to present to you today is what were some of the differences that actually happened between the two geographic, we had two geographic communities, even though they shared a similar identity. And then the last model I want to discuss really, really quickly, because I think a lot of us on this call probably engage in this kind of model on a regular basis, but don't necessarily call it this, but it's this university CBO collaborative partnership where many cities and many places have universities or academic institutions that have research projects and studies, but really, need to, or it's really not just the need, but should collaborate with community-based organizations in order to implement their studies. So one of our colleagues on this project, Gary Harper, developed this model so that folks could actually think about it in a stepwise fashion. And especially for universities and researchers, when they are thinking about going into this collaborative partnership, to make sure that they are kind of in line and follow some steps, which is when you select your partner, to ensure that you establish this and develop this reciprocal relationship, that there's going to be some, there's going to be some give and take, there's going to be capacity building on both sides, there's going to be positive outcomes and gains for both parties, and to work together to decide what the research and evaluation questions are, or at least have some agreement as to what the research and evaluation questions are, conduct that research and evaluation in partnership with the CBO, incorporate and partner with each other to do the data analysis, and then of course to work with the CBOs to disseminate findings. So, so this is kind of just the model that says, to me, that research or academic institutions should not do this alone, and if they're and if they're going to engage in some kind of partnership, that they need to make sure that they check all these pieces. So now that you know a lot of the theoretical frameworks and kind of where our research team was coming from, and where our community partners were coming from, and hopefully the community member is kind of what we shared, all of these different contexts and the way that we wanted to work. I'm going to do a brief overview of some of the actual aims of the study, so you know what we actually did based on all that great theoretical stuff I talked about, and a little bit of data. But just a little bit of data. I think the heart of this presentation is really going to be kind of the narrative and descriptive work that we did to kind of come up with, to explain a little bit of the data. So what did we do with POSSE? POSSE was a 5-year project, and the overall aim was to see if popular opinion leader in its adaptation could be effective within the HBC, Kiki, and family communities. And what we wanted to look at is to see if we could decrease sexual risk behaviors, especially unprotected anal intercourse, decrease sexually transmitted infections, and decrease HIV stigma. And we wanted to evaluate this in 2 different studies, and looking at the strategies, the barriers, the facilitators. So what were the different things in the 2 different cities that may have made the POSSE implementation of POSSE harder or easier? And a core element of the intervention in both cities was our community advisory board. Our community advisory board, we did our best to have representation from all the different houses within each city. And the CAB helped us to really implement a lot of the study activities, especially our social events, such as the balls and our lounges. So we had between 2016 and 2019, we had a POSSE sponsored large event every 6 months. We had a very large ball, and then we had a mini ball. And we had every 6 months, we did a series of lounges also, at which we were able to conduct our study visits. So the lounges were small events, but we still had about anywhere from 40 to 75 youth attend. And when they came, either right before or during, or we could schedule them at another time, we would ask them to complete a survey that included risk behaviors, housing status, healthcare access, their perceptions on HIV stigma, and then they were able to take an optional HIV and STI screening. So they were shown how to do a self-administered anal swab if they chose to do that. We had folks on board, whether ourselves or community partners, who were able to do a rapid HIV test. And so we were able to, we had 580 participants opted into the STI testing, and HIV results were collected from 428 participants. And then we also had, we gave folks the option to just self-report their HIV status, and 103 participants self-reported that. So some of the basic demographics, most of our youth were 18 to 24. And we had the project was geared primarily towards Black and Latinx folks. This is how they self-identified based on the options that were available on the survey. So you'll see the majority of our folks identified as African-American. And then gender identity, majority of our folks identified as male, cis male. And then we had some trans female, trans women, a few folks genderqueer, non-binary, a few gender fluid, and a few female. So again, so some of the results, and this is not, disclaimer, this is not super fancy. This is really just to kind of give you an idea of how things went between Chicago and Philadelphia, because I think what we really wanted to discuss today is why the differences happened, not the actual differences between the two. So data, an in-depth, robust data presentation would happen some other time, or you could read it in one of our papers, which we're happy to share if folks want to look at that. But Bevin and I are more kind of the context people at this time, at the moment. And that was kind of what was, for us, more interesting, and actually, honestly, more fun, was to look at the different cities in that way. So overall, STI rates were really similar and consistent throughout the data collection wave. So again, think about it, we did waves, we collected data in waves every 6 months for 2 to 3 years. And so it's pretty consistent. So we didn't have like a huge change there. And then as far as the age breakdown, the 15 to 17-year-olds and the 18 to 24-year-olds were pretty similar as far as their STI rates. You can see that as far as just percents of the reactive HIV STI results, STI results. So there were and if you think about the numbers that we had very few, trans male participants and very few trans female participants. But if you see their reactive STI results were pretty high considering the number of folks that were participating. We had a little more chlamydia than gonorrhea. And I know those numbers don't add up, but I think it's because some people had both. And then our self-report HIV status was either via the survey or the study visit. And what we saw is that the Chicago cohort saw much greater numbers of HIV positive youth than we did. So during all the time that we did all that testing, HIV testing, we had a number of folks in Philadelphia who self-reported their HIV positive status. However, we did not identify any new seroconversions throughout all of that testing. Chicago discovered 42 new folks who did not know their HIV status, that they were HIV positive. So they discovered 42 through actual study visit HIV tests. Despite the fact that we in Philadelphia, our young people did report higher rates of unprotected anal sex. I think it's interesting. So then just to show this to you in a little bit different way here in a lovely table. Thank you, Bevin. And between the two different cities, so the self-report with HIV and AIDS, Philadelphia, we saw, that 12.6 self-reported in the survey and 8.6 reason declined HIV screening. So if folks said that they wanted to do the STI and HIV screening, we gave them the option to let us know if they wanted to. I already know I'm HIV positive. I don't really want to take this test again, but I'm willing to share that information with you. But in Chicago, we had slightly higher numbers there. Again, the positive rapid test, we did not have any positive HIV tests at the study visit, whereas Chicago had 11.1%, which added up to or resulted in about 42 new positives. Not a huge difference in gonorrhea and chlamydia, but still a little bit higher in Chicago. Again, we found slightly higher percentage of condomless anal sex in Philadelphia than in Chicago. And also at least once a month, well, at least once in the last month in Philadelphia. So recent condomless anal sex. Exchange sex was very similar. Using research visits as a primary access to healthcare. So this was our way also of asking or trying to determine where folks getting a lot of their HIV testing done as a result of participating in a study, or were they able to get access, whether because they were motivated to do so or it was available and easily accessible to be able to get a test anytime they wanted. And as we see in Chicago, a greater number of folks said that, yes, I use my research visits as my primary access to healthcare. And yet very similar across both cities, claiming to have a primary care physician. And then we had a slightly higher number of folks in Philadelphia who had taken PrEP than in Chicago. So I'm going to turn it over to Bevin, because now that you know about some of the differences, we've been trying to kind of think about and talk to community members and go through all the data and just kind of think about like, well, why do we have these differences between two cities? So two similar communities, but geographically in different places.
Right. So obviously, both of these communities shared certain structural norms and different things, but they also developed, as Marne had talked about earlier, like we have this house and ball community as a general overview, but then we have Chicago and Philadelphia. And one of the things that we found in Philadelphia was that there was definitely an increase in youth participation and leadership that was spurred on by the growth of the Kiki scene during this whole process. So just a quick definition of what health equity is. This is the definition according to the Robert Wood Johnson Foundation. And it's just that everyone has a fair and just opportunity to be as healthy as possible. This requires removing obstacles to health, such as poverty, discrimination, and their consequences, including powerlessness and lack of access to good jobs with fair pay, quality education and housing, safe environments, and healthcare. So there's a lot in there. How does that really break down? How did we kind of try to address any of that? How did the community want to address any of that? That's sort of what we're going to get into. So one of the things that we in Philadelphia definitely had on our side is that there was at least a decade of work that had been happening already, some actually with Marne and various sort of team members that Marne has worked with over the years, doing sort of different community mobilization efforts with the house and ball community. So there was definitely some improved prevention messaging, addressing stigma and linking to resources that was already happening. So we had this really helpful base to sort of jump off from. And then, we sort of looked at what was sort of happening. How did community in Philadelphia versus what was going on in Chicago or wasn't going on in Chicago? What impact did that have on what we were doing? So definitely, in Philadelphia, we saw that there was more collaboration between, CBOs and house and ball leadership. Again, as I just mentioned, there was this like decade-long history that was already there. And that sort of continued, obviously, while Posse was happening. And we found that overall in Philadelphia, the community in general was open to the project that we were doing and the events that we were holding. We'll talk a little bit more about what some of those events were in just a minute, but it sort of was really helpful that we just had Philadelphia in general was excited about what was happening and wanted to be a part of it. And in Philadelphia, the House and Ball and Kiki leaders also served as prevention professionals in a lot of different ways. So not just through Posse, not just through the opinion leader model, not through the study, but they were also working at a lot of the CBOs. And so we had multiple connections in that way. You might be this person might be on our CAB, but they're also working at one of the CBOs that we're partnering with. And then the Philadelphia Department of Public Health also was, very helpful and has been working to ensure access to services. So one of the things that we also found was there was a surge in prevention programming in Philadelphia when this happened. It was kind of like perfect timing for us, right? The PrEP initiative, Club 1509 was happening. And these established relationships with organizations in the health department and the house and ball community and the Kiki scene just made it so that there was more access to resources. So if you have leaders in the community who are working at agencies or who are collaborating with agencies, it really does help to impact the access to services. And also younger folks might feel like, oh, well, someone that I know and trust is working with this organization or recommends them. So it's more likely that they'll, actually go and check out what's happening there. And then, as Marne had already mentioned, as you saw from the data, that both youth in Chicago and Philadelphia, most of them said that they had a primary care physician, but still, young folks in Chicago were more likely to use the study visit as their sort of access to STI testing and HIV testing. And so it could be that there was some of that was at play, and that, they knew that folks that either worked places or working with places were, trustworthy in their eyes because they know folks. And I'm using quotes, not because they're not trustworthy, but just because, it's all about perception, right? Just because you don't know somewhere doesn't mean that organization isn't great and wonderful. So one of the things that we also did was we talked a lot with our community advisory board and with our popular opinion leaders about what they wanted to do and see in the time that we were spending with them. What should events look like? What should programming look like? What should we be trying to do in terms of prevention work? And that was like mostly sure, great, talk to us about HIV and STI prevention, but talk to us about all these other things too. And so we really worked hard to kind of build out non-traditional partnerships and look at capacity building. So we kind of took this multi-prong approach to prevention by pulling in all these different partners from all over the city and different organizations to really address health promotion and the needs that our community members were telling us that were there. So, we also wanted to, as I said, look beyond HIV care and testing, because again, we were hearing a lot of prevention fatigue. Folks hear from everywhere, use a condom, don't do this, don't do that, do this instead, do this instead. So we, did some things around voting rights. We looked at credit and budgeting. We did some violence prevention work. We had a couple of fun sort of chat and choose that, talking sexy about sex and sex and tech talk. We worked with the Free Library. We're still working with them to try to do some more programming, the Art Institute and the Mutter Museum as well. So we really tried to kind of like see who else was out there, who we know is working with these young folks, but might not know they're working with these young folks. Or just kind of also making sure that young people in the house and ball community also are accessing these services, because Philly has a lot of great resources. And I think sometimes I forget about a lot of them and don't access them as much as I could. So, we were just sort of thinking about that. So we also, in the last year and a half, right, has been kind of nuts for everybody. We have been, sort of behind screens with everybody, right? We are not really able to have in-person events. We haven't been able to just do the things that we had been doing. So we were sort of shifting like everyone else. And we started to host virtual lounges. So we had been holding lounges every month in person, even when study activities weren't happening. And we found that we were able to do them online on this platform called Big O, and it was, wild and fun and interesting. And we've still been meeting with our CAB. The Community Advisory Board has been really, integral in this shift, and sort of talking about how we move from being in person to virtual. We also sort of heard that there was a need to get some information out about what's safe in COVID, what's not safe in COVID, and like how to sort of just do that in a way that makes sense for young people, because, there's been lots of information from the beginning, and it can be overwhelming how much is out there, but none of it was really specifically geared towards youth. So a team of folks at the Adolescent Initiative have been working to kind of do some of that, and we were able to also bring it to Posse. And then we also continuing to make sure that we're not just doing sort of prevention messaging in terms of like, wear your masks, wear condoms, don't do this, do that. We were also making sure that we were talking about other things that were impacting folks, food security, stress and anxiety, and all the things that sort of came along with COVID, and then marking days. If there was a national day around, like National Domestic Violence Month, Awareness Month, we did some posting around that. We talked about seasonal affective disorder, because that was something that actually came up with some young folks that we work with, and they were like, this is really like impacting me in a way that I didn't realize, and in a way that I didn't know, and I didn't even really know what this was, and it feels so much worse this year. So we just did some slides on that. So we just tried to kind of make sure that we were still being responsive, even though we weren't able to be face to face with each other. So I think, some of the main things that we sort of felt were really important from this, and Marne, feel free to jump in here at any time as usual, was that, despite similar demographic profiles, just in terms of, it's the house and ball community, it's these folks, these are their ages, this is sort of the demographic of this community, it is really important to remember that local context is key and really important when trying to figure out what's going on with health trends. Philadelphia did see this rebirth of prevention navigation programming, while Chicago didn't. And there was also the additional sort of like ground level stuff that had been going on for the previous decade that was happening in Philadelphia that didn't really happen in Chicago. Having organizational buy-in and collaboration just increases access in general for everybody. If you can get folks to the table and have everybody be like, oh yeah, that makes sense. One of the things that we always made sure that we did when we were trying to collaborate with anyone, whether it was someone from the community or a large organization, was offer something. Like, here's what we can bring, here's what we're asking of you, but here's what we can give you too. And then, fostering relationships within the house and ball community within Kiki leaders just sort of ensures that, appropriate programming and prevention messaging and care strategies are in place to serve the youth that we're working with.
And just to add to that, to loop back to your comments earlier, Bevin, about health equity and bringing that as part of this context, which is one of the things that in reflecting on the differences here, and because I think in the past couple of years, there's been a really important focus on health equity, is that thinking about HIV prevention within the health equity context forces us to really expand what the notion of prevention is, or what can be logically linked to HIV prevention. And for us and for the community, it was many of the things that Bevin listed, which is access to places like the library, access to financial literacy, all those kinds of, because for the library, for example, that meant like GED courses potentially, or computer access, financial literacy, that's potentially for folks to be able to purchase additional, have the ability to purchase additional resources to establish credit, all these kinds of things that are kind of day-to-day, that can be day-to-day kind of activities, but without them, the level of health equity really diminishes for folks. And then how can we expect them to actually be able to, to counteract some other disparities that maybe are putting them at greater risk for something like HIV acquisition. So I think we were able to work with our community because of all the things that Bevin was just discussing, openness from the community to work with us, our individual connections. I think especially Bevin's capacity to just ask and say, hey, would you like to do something? And chances are they couldn't turn her down, or she already knew somebody and said, well, would you like this? Or just to keep our minds open when we're thinking about HIV prevention, as to keep our minds open as to who our partner should be and what the activities might be able to be. Because oftentimes when we had some of these outings or events, or worked with other folks and brought in these, whether it's a speaker or access to the art museum, for example, it was a moment where folks could bond and kind of like come together as a community about just something new and something fun or something different. And maybe some of those conversations around prevention, or some of those other conversations that were also, or other capacity building moments, could happen within those events. And I think just for us as providers and researchers to also kind of expand our reach into those other areas. Number one, makes it more fun and more interesting, but also I think just gives us just greater opportunity to serve the community. And so we really need to think about leveraging our connections as well as the connections of the community. And I think that for whether it's just the nature of, we haven't completely figured everything out, whether it's the nature of the way Philadelphia is laid out, whether it's just the history of how we work together. I think, AIDS Education Month, the fact that for years and decades, all of us as community partners have been coming together to work on something like this as a city is not replicated in most other places. So I think that, there's a lot of things like that in the context of Philadelphia that gave us the ability to do this kind of work And when you look at the data, it does make a difference. It does make a difference in whether our young people are getting HIV or STIs. In a way, in a way, so in Chicago, they weren't able to necessarily do the same thing. So, kind of proud of us and happy for us here in Philadelphia. And hopefully, as things start opening up, we can continue to do a lot of that work.
Yes, because I will say our community advisory board and the folks that we're working with are ready. They want to, one of the things that I think has been really amazing in my eyes is that, when we talk about potential partnerships or who else they want to work with, they talk about the opportunity for that sort of mutual learning and access to happen, and really want to be able to also bring something to the table, which I think is, kind of different from the way that a lot of times people approach partnerships. It's just kind of like, how are we going to do this one thing that will be for this one group of people, as opposed to just sort of looking at, well, what can this group of folks bring to this organization, and what can we bring to the larger community, and how that can kind of work together. So we're excited to keep doing all these things and working with probably many of you here today. So kind of it for us, if anybody has any questions.
Wonderful. Thank you so much for that excellent presentation. And thank you for this continued relationship. It's been, 5 years that you all have been presenting on the Posse project, and it's been a journey. And and this year has been no exception. So to our audience, please, this is, as I've been saying, this is your time to put on your thinking caps and ask any questions of today's presenters. And while everyone kind of thinks about questions they want to ask, I just kind of want to ask, kind of speaking to the longevity of the project, what are some of the more or most surprising things you all have learned from working on this project over the last 5 years, right? Oh, you're muted.
I know, I'm sorry. I'm trying to think of like surprises. Gosh, Bevin, what were we ever surprised? I think we were surprised by some of the things that we did.
Yes, that's for sure.
Some of the places we went. I'm in the context of this presentation. If you had told me when we were just thinking about it and submitting it for funding that we would be in conversations with places like the main branch of the public library, or the Philadelphia Museum of Art, or any of those places, when we put it up, we were like, yeah, we want to do that. But if you told me that that's what we were going to do, I would have been like, what are you talking about? We're not doing that. Like, that's not what this is about, or that's not what's going to make sense. In the beginning, I don't know, Bevin, maybe you always had those dreams and aspirations, but
I did.
Yes,
that grand staircase of the art museum, that was like my pinnacle. I think if I'm thinking about data stuff, this actually was something that surprised me. Like, we really were intrigued by what was going on with, the difference between the HIV rates in the two cities. And yet, obviously, like, the STI rates were kind of similar. So there's a little bit of like, what's going on there too? Like, is it that more folks are on PrEP? Is there something else that's happening? So I think that was definitely one thing. I guess I'm trying to think of some other things that were maybe surprising. I love this project, has been so much fun, and I usually joke about what my job is, like sort of being an event planner, because I got to do all these fun things, and I did some research on the side too, right? We collected some data, but I think it's just been a lot of fun. But I don't know if there's any other like surprises, so to speak.
Yeah.
Well, thank you.
Stumped us.
Sorry. So it looks like we have some questions coming through. Thank you, everyone. What, if any, resistance did you encounter from institutions in your investigative and prevention interventions?
I think I was really surprised by the lack of resistance that we had when we were interacting with institutions. As Marne said, like, I'm not really afraid to ask anybody anything. And I think, you know, we had an incredible team that was working on this. And I think, again, because of the work that had happened before this project came around, you know, we definitely were able to build off of that groundwork. And I also think that because we weren't just asking for things, again, being able to go and say like, oh, well, you know, you're working with a bunch of youth this summer. Like, for example, with the free library, one of the things that we did was they had summer interns, and we went and did like an HIV and STI prevention for their summer interns. You know, when we went to the Mutter Museum, like, our folks got to go through the museum, they got a little presentation, they got to learn more about what was offered sort of through some of their STEM programming. You know, I think folks are really interested in connecting with this population because they recognize that they're maybe not reaching them as much as they should be. And so they're kind of open to that, and then willing to kind of say, well, yeah, we can do that other thing you want to do too.
Yeah. And I think what is always hard, and I think anybody who works with young people and large groups of young people is, I think that, you know, it's part of as advocates for young people to go into spaces, to go to really, you know, to prepare people and to, you know, make sure that we have nice spaces for young people to go to, but that when they're there, they're treated fairly. Also to make sure that young people understand what the expectations are in those spaces, because, you know, there have been times in the past where, you know, people are like, no, we're not going to do that. Or when we get there, they're like, what's going on? Who are these, you know, who are these young people? I didn't know, you know, these folks were coming in. So, you know, there was definitely some times like on the spot where Bevin or myself or somebody else had to kind of do a little bit of education around that. And, you know, just to be transparent, you know, CHOP is no different, you know, as far as CHOP spaces, to be able to have these large events. And it took some time for us to broker relationships within the institution so that it, you know, this, even though it's a safe space for these young people to come as patients, but for them to come as participants and to, you know, to be in social events, we did a little bit of work with that. So, you know, so there was a little bit of, I think, hesitancy or, you know, kind of uncertainty at one point, but I think we're in a really good place right now, and I think we need to be persistent about that.
Awesome, excellent. And one of the things I am always impressed with, especially with the spaces that are created, is your ability to not, you know, oftentimes when things are made for youth, it's pandering or it infantilizes the youth. And I'm always impressed how much you involve the youth in the planning, and, you know, you prioritize autonomy and like you know, them allowing to identify themselves as themselves and create space for themselves and be part of that space creation. So I think that's always important, you know, not saying, hey, we've created this for you. You know, we've created this space for you, you know, you're part of this. So yeah, I'm always taken by whenever there's an event put on, I'm like, oh, this is definitely something the youth want to go to. So
thank you. And yeah. Kyle, and you've been there and you've helped us with some of those events too. Yes. So I know you've partnered with us to make them happen. So thank you for saying that. They're
a blast. They're a blast. Absolutely. So we have some more questions. Impressive study. Thank you for disseminating these results so clearly. In an effort to advance health equity locally and to identify some of the community influencers who can advance risk reduction, our organization wants to reestablish a CAB. Can you share a bit about this piece of your work? Where were you able to access funding? What incentives, compensation did you offer participants?
Wow. Okay.
Yeah.
I know.
It's a good question.
It is a good question. Do you want to start, Bevin, and I can fill in a little bit?
Yeah, so we, one of the things that I think is important to mention about how we sort of, and I say we like I have anything to do with it, but the folks that write the, well, I don't do anything around the budgeting, but the people that are in charge of the budgeting make sure that we put in things for, line items for cabs and for like consultants, so that we are able to compensate people for their time. Because that's another big thing that I don't think that we mentioned in this presentation, but we do, everyone that works with us on planning an event, a project, whatever, they get an honorarium because we know that their time is valuable. So one of the things with the cab was that, one of the staff members on this project was, he was involved in the house and ball community. And again, Marne had established relationships with folks in the community. So it was kind of like going back to some of those folks and saying like, hey, we're doing this project. We're getting together. Are you interested? And making sure that we, again, because of there's like clear hierarchy in this community. So it's kind of easy to say like, oh, well, you're a mother or a father of a house. You are someone who has influence. That makes it a little bit easier to be like, come join us, because they are a leader in the community already and identified by that sort of name, title. And then there was more to that question and it flew out of my head. Marne, you jump in.
You got it. So just a couple of things. So nuts and bolts wise around funding, because yes, getting funding for different types of things can sometimes be tricky. So if you're participating in an NIH funded project of any kind, there's usually a requirement to have a community advisory board, in which case there's going to be a line item for that. So that's really great. And it makes it kind of easy. Like, we have to establish this CAB. It's a requirement for conducting a research study. However, if you're not a research project, I think there's some other ways that you can establish an advisory group in your organization, and whether there's a lot of different ways that folks can participate as a group, whether you decide to have a coalition, a working group, a task force, a group of local health experts. So, I mean, I think you think about, what is it that's really going to make sense for your organization to establish, and then think about how that can be logically linked to your community engagement or community education or community mobilization component. And maybe that's where you can look within your funding to say, it really makes sense for us to have a community engagement component. And now, potentially either you're looking for additional funding, or is there existing funding with what you have that you can parse out a little bit of money to get some food and give folks, a small, it could be a small honorarium for their time. It could be, a little bit larger. But I think, right now it's really important to consider that. I think that organizations, whether they're doing it within their own existing kind of core funding, or they're going to link it to a project that has its own funding component to it, we need to make sure that when we apply for money, that we're putting that in, that there is something. And even if you don't know exactly what it's going to look like, or it's going to have to morph into something, there needs to be a line item that says, I know I'm going to need input from the community and they should be compensated for their time. So moving forward, I would suggest that. And looking backward, I would look at what you have already and see, like, is there some place where you can say, this project really needs community input at the moment, and so we're going to kind of divert some of our funding and to do that. So that right now, even though POSSE, the funding for POSSE has ended, we are continuing POSSE, and the way that we're doing that is because we consider it a really important part of our community engagement and education within our programs as well as our research. So, POSSE unto itself is just considered another one of our CABs. And so, and then whatever we do, we move forward in that way. So I hope that was somewhat helpful.
And our CAB actually only meets quarterly. So, you can figure out a way to make that work within the funding that you currently have too. It doesn't have to be something that meets monthly. Our youth advisory board meets more regularly than our our posse cab does, but our youth advisory board functions in a different way and does some different things. So I think that's also something to keep in mind.
And then the last thing I'll mention is that once our posse funding was our direct posse funding had ended, one of the ways that we were able to sustain our cab is we actually partnered with Babashi, and they were able to get a small grant. And since we both wanted to continue to partner working with the house and ball community and with posse, we were able to partner to go in on a small grant and then to be able to share funding. And the cab is able to then provide input to two organizations, in that partnership, to Babashi as well as to us. So that was a way that we were kind of able to continue all those relationships, but also kind of like leverage funding opportunities. So that's another piece here too. Is there a community partner that both of you need this input from a similar community, and maybe you can kind of work together to make sure that you can have proper staffing and compensation for your members.
Awesome. Thank you for that. And thank you for that thoughtful question. So we have another question. What special considerations were there in your work with minors?
Bevin's smiling. So we always work with minors because we are adolescent focused. So our population is technically 13 to 24. I think for posse, was it 15 to 24 maybe, but still minors. Yeah, it was 15 to 24, but overall. So still minors for sure. So, there were definitely some, as far as ours were concerned, they were definitely geared towards, we didn't have split things, as far as like the over 21s, the under 21s, like it was always, I don't want to say G-rated because it wasn't G-rated either, but they were definitely, we definitely had policies around like, no drinking, no smoking, no drugs and alcohol on the premises. It was never available, even if we're at a venue. So there was that piece to it. We have an institutional review board that makes sure that all of our consent processes are appropriate for folks who are under 18 as well as folks who are over 18 as well. So we had so we definitely are like have checks and balances with us around that piece. We also, I think it was really helpful to, when we had events, to have other community advisory board members there to help us kind of like chaperone different types of things, or additional staff if we needed. Sometimes it was Kyle, but you were there too when we had our Kiki balls. So, making sure that we had enough adult professional staff present so that, anything that got out of hand or if a young person needed additional support, we would be able to address it and take care of it. All of these events also, and this was at the behest of the community as well, because this is a standard when balls happen. We did hire security staff, so that way, the staff themselves could also stay safe, and we had professionals there. And again, that was something that is standard in any house and ball or Kiki event that you see. Bevin, any other thoughts as far as like minors?
No, I mean, I think that pretty much covers it.
Yeah. So, so between the consenting process and safety protocols, I think those are the two biggest pieces for us. But again, since this is our, population working with young people, we generally have all those kinds of things in place.
Awesome. Thank you for that. And it looks like that is it for questions at this moment. Before we kind of wrap things up, do either of you have any final thoughts for our audience members?
I don't think so. Thank you for joining us. Obviously, thank you to our CAB and all of the HBC community members that made this project possible, because obviously without them, we wouldn't have been able to do it. And thank you for having us.
Yes, thank you. And please feel free to reach out if you have any additional questions or ideas for collaboration. We are open to all of that.
Yes, please.
Wonderful. And if you want to learn a little more about this project, you can actually download a poster from our research
Yes.
poster library. So check that out as well. Just go to the page where you went to register for all of our webinars, and in the sidebar, you'll see a research poster library. You can peruse all those wonderful resources there. So Marne, Bevin, as always, it is a pleasure to have you. And to our audience members, thank you for always being amazing, wonderful, and inquisitive about all we've been talking about all month. So don't forget to take the survey at the end of this presentation. And don't forget to join us next week for our 5th and final week of this year's HIV Prevention and Education Virtual Summit. Thank you so much, everyone. Take care.
Thank you, everyone.
Bye-bye.
Bye-bye.